Obstructive sleep apnea, or OSA, is a sleep disorder that causes brief pauses in breathing while you sleep. These interruptions happen when airflow through your nose or mouth becomes blocked. When you fall asleep, your entire body relaxes, including your throat muscles and tongue. This normal response can block the airway in people with obstructive sleep apnea. That's because they typically have a physical abnormality or a narrowed airway that already hampers airflow. Snoring is a common symptom of obstructive sleep apnea. It is a sign that breathing is being restricted. When breathing stops, snoring is often followed by a period of silence. Your brain responds to the lack of oxygen by briefly waking you up. You may snort or gasp as you start breathing again. These episodes can happen more than 30 times in an hour. They can severely disrupt your sleep. They can also cause morning headaches, daytime drowsiness, irritability, depression, and memory problems. If left untreated, it can lead to high blood pressure, strokes, irregular heartbeats, and even heart attacks. What's more is, drowsiness raises your risk of being in a car accident. Early diagnosis and treatment can help you avoid these serious health concerns. Now let's look at how Cpap works. Cpap treatment uses gentle flowing air to keep your airway open. A small, lightweight machine gently blows air through a tube that's connected to a mask. You wear the mask while sleeping. It may cover your nose or mouth, or both, depending on the style of the mask and your needs. The mask also has straps to keep it in place. As you sleep, the air pushes your tongue forward, keeping your airway open. Your healthcare provider may recommend a sleep study or polysomnogram to figure out the best setting for you. A sleep study takes place in a hospital or sleep lab during your normal sleeping hours. While you sleep, technicians measure certain body functions, such as breathing patterns and brain activity. They also track your sleep quality and duration. When using Cpap, you will need to see your healthcare provider periodically to check your airflow settings. They may need to be changed if you gain or lose weight, or if your symptoms don't improve. What to do while using a Cpap device? To get the most benefit from Cpap treatment, you should use it every time you sleep, even when you nap. Keep in mind that it may take a few weeks for you to adjust to the treatment. In particular, try wearing the mask for a few hours during the day to become used to it. If needed, gradually build up the amount of time you wear it at night. Cpap is painless, but it can cause some side effects, including skin irritation from the mask, dry mouth, congestion, runny nose or sneezing, nosebleeds, and upset stomach from the airflow. Following the setting, washing your mask daily can prevent skin irritation. Follow the cleaning directions that came with your mask. Use only the cleansers recommended because others can damage the mask. Some Cpap machines have a heated humidifier to relieve dry mouth, sore throat, and other nasal problems. The device can also be set to slowly ramp up airflow to ease any stomach troubles. If your Cpap device is causing problems, talk with your healthcare provider. You may need a different mask or adjustments in the airflow setting to make it work for you. Thanks for watching. Please subscribe and support us to learn more. Thank you.